Hey everyone, welcome to NowRx office hours. We're going to let everyone get logged in here, give everyone a couple seconds, and we're going to take your questions. For those of you that may not have logged into office hours previously, the format is such that we assume you've gotten a basic understanding of NowRx. You've seen some presentation materials. Hopefully you've gone to our YouTube channel. If you go to the NowRx YouTube channel, there's a lot of recorded webinars out there. You can take a deeper dive. We've covered a lot of topics in the past, anything from competitive landscape to the technology to how do you make money on a crowdfunding investment like this. So I really do encourage you to get out to YouTube and look at the NowRx YouTube channel, and there's a lot of good information out there. But we are assuming you know something about NowRx, and we're just going to take some Q&A here for a half hour. I'll try to stay a little bit past that if we get a lot of good questions, and we have more coming. So I have a moderator that's feeding me questions, and I'm just going to start jumping right in and take them. Question number one, how do you plan to compete with Amazon? So something to know about the pharmacy industry is to look at it from a perspective of distribution method. Everyone knows retail pharmacies like CVS and Walgreens and Rite Aid control most of the pharmacy market. So most of the business is retail. There has always been a mail delivery distribution method in pharmacy. A lot of people haven't heard of the company names, but Express Scripts is the biggest mail delivery pharmacy in the country. They do about 60 billion annually. OptumRx and Caremark are two others. And so mail delivery in pharmacy, that is where you get a prescription through the mail, takes 5 to 7 days. That's been a standard in pharmacy for 20 years or more, even before anyone ever heard Amazon. There's been an e-commerce model in pharmacy. And so that's nothing new to get prescriptions through the mail, which is what Amazon's attempting to do, right? Amazon Pharmacy, you fill out your prescription online, it goes to a UPS driver or one of their own drivers, and you get it in 2 days, right? So that's a mail delivery function. If you look at the stats in pharmacy, the number of prescriptions being filled by mail delivery in the last 10 years has gone down. So mail delivery doesn't work well in pharmacy. It works well for some narrow cases, right? For some patients that have medications that are on sort of auto refill, they never change, the doctor doesn't change the dosage. That works okay for mail. Mail pharmacy is about 1/3 of the industry, but again, it's losing market share. So that tells me that customers in pharmacy want same-day delivery. That's what they've grown accustomed to. And that's why retail still dominates pharmacy, whereas you see in a lot of other areas of our lives, retail is going by the wayside. In pharmacy, retail has more than held its own against mail delivery or e-commerce. It's just a fact. The last 10 years, retail has grown in market share relative to an e-commerce model. So in pharmacy, customers have gotten used to same-day delivery. And in order to do same-day delivery in pharmacy, the other thing to think about in pharmacies, it's not like other consumer businesses. In most consumer businesses, the consumer just decides to order a product and that's it. In pharmacy, there are 4 stakeholders that have to get involved in ordering a prescription. A physician orders a prescription, right? Patients don't order a prescription. It's a healthcare function. There has to be an insurance company involved in at least 90 to 95% of all transactions go through insurance. And so you need coordination with insurance company in addition to the physician. You need a pharmacist by law involved in the transaction doing verification and the customer themselves. So there's 4 stakeholders that have to coordinate. If any coordination breaks down amongst all of those 4, then you're not going to get that prescription today. You're not going to get it filled. And this is a big problem in pharmacy. This is why the retail pharmacy companies have such a poor customer experience. It's one of the reasons. They also use a lot of manual processes, but the collaboration between physician, insurance company, pharmacist, and customer is managed by software. And the software in the industry is antiquated, 30 years old. Walgreens uses an AS400 system. They used to call them the green screen computers, the mainframe computers, and CVS isn't much better. So this industry has really antiquated software, does a very poor job of coordinating collaboration between all the four stakeholders. It's also plagued by a lot of manual processes, like people counting out pills manually or calling insurance companies and waiting on hold while you're kind of standing in line. Physicians, they have confusing prescriptions. They don't follow up on refills. There need to be clarifications. Insurance companies reject medications. A third of all Americans have had an insurance company reject a prescription medication in the last year. So these are the problems that are inside pharmacy, and you've got to fix it with better technology. And that's what NowRx has built. So we've spent 5 years building what we call our quick fill pharmacy management system. And we're the only ones that have it. We think it's the best pharmacy management system in the country. I mean, there are other pharmacy management systems out there, but we built our own unique proprietary and what we think is cutting edge software technology. What Amazon Pharmacy is doing is they're using industry software system. I think they use QS1. I'm not 100% sure, but I know they don't have their own pharmacy management system. How do I know that? Because all pharmacy management systems in the country are approved by a company called SureScripts. And if you go to the SureScripts website, you can see every approved pharmacy management system in the country in use today. And you won't see one by Amazon or PillPack. You will see one by NowRx. So how do we compete with Amazon? Number one, we have way better software systems that we believe gives us a differentiated experience. Customers that come to NowRx have fewer mishaps with their insurance company, have fewer mishaps and failures to coordinate with the physician and the pharmacist. We have our own logistics system. So we manage all of that under our software. That creates a better customer experience. And again, if you're going to do same day delivery pharmacy, you can't use the mail. You have to go same day delivery with a courier. You need micro fulfillment. Now, can Amazon build all of that I just said? Well, they spent the last 5 years in pharmacy and they haven't built any of that. So they can, but we are 5 years ahead of the game and really ahead of all competitors. There's a lot of webinars out there. Go to YouTube, NowRx, you'll see some webinars on competition and how we differentiate. There's a webinar about our technology. We are highly differentiated. We believe it's defensible against all comers, even Amazon's. So we feel really good. I mean, we've been competing head to head with Amazon Pharmacy for the last 2 or 3 years. And look at our growth rates, right? We've been growing 60% annually. And I think that growth is going to accelerate as we launch new territories. So that's how we compete with Amazon. How will your patents give you an advantage over your competitors? Just like any other patent, you can defend it in court. You can, first of all, we haven't been awarded patents. We have 2 applications. We're still waiting for what they call prosecution, which means your patent is approved, and once it's been fully prosecuted, you get approval. You don't get approved until it gets prosecuted by the patent board, the patent office. So we think a patent will help us in our defensibility, but frankly, we're so far ahead now, in my view, 5-6 years, that even the patent is, I think, superfluous, to use a big word. We spent years working inside the pharmacy, my co-founder and I, coming to a pharmacy without knowing anything about it. We sat inside a pharmacy. We looked at the pharmacists and the technicians. We looked at all the software that was available and in use. We looked at all the problems with those software systems, and we create a better system. And then we've also changed the business model, where rather than relying on retail space, we use micro fulfillment centers where we house our own inventory. We use robotic dispensing that can count, bottle, sort, label, cap a medication in under 30 seconds. That's something you won't see at CVS or Walgreens, right? And again, you're trying to do same day delivery. You need a bunch of technology and automation tools to make that seamless. And you can see that in Yelp reviews. NowRx maintains 5-star Yelp reviews across all of our micro fulfillment facilities, and none of our competitors can compare. If you look at Amazon's experience, their customer experience, go to trustpilot.com and look at Amazon Pharmacy. It might be under PillPack, but they have 81% 1-star reviews. This is the greatest e-commerce company in the world, supposedly, and they have terrible customer experience in pharmacy. And the reason is they have terrible software systems, and they haven't moved away from mail delivery, which doesn't work well in pharmacy. Sorry to say. Can they fix that and right the ship? We'll see. It's a $500 billion industry. So if Amazon was to take over, suddenly write a new software program in pharmacy that was as good or better than ours, let's just assume that was possible, and they moved to a same-day delivery model using micro fulfillment, which is the only way to do that, give them what, 10, 20 billion in revenue in a $500 billion industry, we'll still have plenty to work with. Question number 3. Why is it time to close this round of funding? We were targeting about a $50 million raise for this Series C. However, the business has really grown spectacularly through the first quarter and almost the first half of this year. And we feel like we can get a better valuation now. Remember, the valuations for crowdfunding rounds are set before you start the round, which is going back to August, September last year. And we set that valuation. It was about 10x of forward-looking 12 months. We are now, our forward-looking 12 months is substantially higher now compared to last when this valuation was set. So we feel like, a $30 million raise now at this valuation is plenty for us to continue on our growth path without, overly diluting existing shareholders. And the anticipation is that the next round will be at a substantially higher valuation. That's our expectation. We'll see if that comes true, but that's why we're wrapping up this round now. Friday's the last day, everyone. Get your investments in. Again, a lot of information available. I'm going to say it throughout. Go to YouTube and check out NowRx webinar videos, information about technology, competitors. We're open books here. I've done tons of webinars. You can go out to the comment forum on Seed Invest. And if there's questions here that we don't get to, we'll post those out there on seedinvest.com on the comment section for the NowRx profile page, right? So we'll get to all your questions as best we can. Question number 4. Good morning, Cary. Hope you're doing well and staying healthy. Thank you for that. Sorry, guys, I'm just going to read this question so I can get to the root of it. I was curious about the demographic profile of a typical NowRx customer. Can you share with investors on today's call what a typical NowRx customer looks like, and how does NowRx plan to target via social media and or email marketing strategies for customers that fit? Thanks, and wishing you, Sumit, and the rest of the NowRx team continued success. All right. Oh, it's from Aaron. Awesome. Aaron, thanks. Glad to have you on today. You've been a great investor and always enjoy your questions. So I think about the NowRx customer profile as sort of 3 different personas that are sort of the sweet spot for NowRx. One is a busy parent or mom. I'll just say mom. Mothers often are the caregivers in families, not always, but some, oftentimes. And so mothers have children getting ear infections, going back and forth to the pharmacy with their kids, all the time. There's a husband usually that has some medications, and oftentimes the mother's kind of taking care of that too. And sometimes you even have grandparents at home and the mother's doing all of that, right? So busy moms is certainly a customer persona that we target and do quite well with. We target pediatric physicians, and we have really good uptake there. The second persona, I call it busy professional, man or woman, just busy, maybe doesn't have kids, but just has a career where it's nonstop running back and forth all the time and looking for more convenience type of options where there can be delivery, right? So that obviously, these are early adopter of technologies and convenience type of services. So that's definitely another second persona. The third one is older patients that just have so many prescriptions. I mean, the average 60-year-old has, I think, 6 to 8 prescriptions. So that's where we're all heading, people, certainly in this country. And they're quite tech savvy. There's a good, strong subsegment of older customers that are tech savvy enough to use an app and to get their prescriptions through NowRx. So those are sort of the target fit customers we go after. I will say, though, we have patients across the entire spectrum of age group and income levels. We have patients that are 1 month old, all the way up to patients, I think our oldest was 97 years old, and everything in between. And in fact, if you look at our customer demographics, if you look at the distribution of at least by age, you will see a bell curve that looks an awful lot like the customers that go where? CVS and Walgreens. Why wouldn't that? I mean, everybody goes to pharmacies. We are a full replacement, and we target every patient that's going into CVS and Walgreens and Rite Aid. That's our target market. We are a full service pharmacy solution. You never need to go to another pharmacy and wait in any lines again if you sign up with NowRx. And that's the market. It's a big market. It's $500 billion a year. There are enough prescriptions in the country for 11 prescriptions for every man, woman, and child in the US. It's more than 4 billion prescriptions annually. That's our market. Now, we do have, two or, like I mentioned, the 3 personas that we think are sweet spots, but really, I mean, anybody going to a doctor and getting a prescription that doesn't like waiting in lines. How many people don't like waiting in lines? Like, what's that demographic look like? How many people don't like having their prescription turned down by their insurance company because the technician behind the counter didn't put in the codes the right way? How many people and what type of people don't like it when their doctor has a inconsistency in the prescription and the pharmacy can't process it until they call the doctor and wait for the doctor to call back, or the doctor didn't send a refill authorization on time, or the pharmacy does a poor job of managing their inventory and they have to come back another day, right? How many people fit that profile? I think an awful lot. Yeah, I think a lot. I really do. All right. How are we doing on time? Good. 20 after the hour. Number 5 question. Are your medications more expensive than traditional pharmacies? And how do your prices compare to Mark Cuban? Great question. So our medications are very competitively priced. We actually have some of the most competitive cash prices available, but I must have to point out, when we get this kind of question, I got to stop people a little bit and say, think about the cost of medications in pharmacy. How does this work? There's another area where pharmacy is quite different than other consumer products. And the reality is 90 to 95%, let's just use 95% as a number because that's pretty damn close. 95% of all pharmacy transactions go through an insurance company health plan. So the patient goes into a pharmacy and hands out their health card. And the medication could be $20, it could be $200, it could be $2,000. In all 3 of those scenarios, the patient hands off their health card and the insurance company pays the pharmacy, and the patient pays what? The copay. It's usually $15 or $20. So the cost to the patient is the $20 copay. The $2,000 or $200 medication cost is not borne by the customer, not in pharmacy. Just think about, like, if you go to a doctor's office, do you know what the cost is of your physical? You go to the doctor and get a physical. Do you ask the doctor, are their physical prices the cheapest around? No, you give them your insurance card. That's what you do. And people, intuitions in pharmacy are they tend to think about it more like groceries or some other consumer product where the patient and the customer pay all the cost of the drug. That's not what happens in pharmacy. 95% of the time it goes through insurance, you pay the copay. Now, 5% of the time, yes, you pay cash, and cash prices are important for patients that are paying for things in cash, but it's only 5% of the market. Now, our cash prices are very competitive. We work with our doctors and our patients and make sure we are hyper competitive on cash prices. We're also very competitive on insurance covered products because we're in preferred networks where the copay is as low as it possibly can be. So how does that affect the cost to the patient? It affects it a great deal. So you've got to take care of the insurance side of it. You've got to be in preferred networks, and you've got to get your patients the lowest copay if you're actually going to give patients a low cost and out-of-pocket expense. Now, what does Mark Cuban do? He focuses on the 5% of the market that doesn't involve insurance. That's what Mark Cuban does. It's 5% of the market. He does not take insurance cards. So if you have a medication that's $200 or $2,000, you cannot get that from Mark Cuban because you can't give him your insurance. You can go to any other pharmacy and give them an insurance card and pay $20, or you can go to Mark Cuban and pay $2,000. So who's cheaper in that situation, right? So 95% of the time, we are cheaper than Mark Cuban because he doesn't take insurance and you have to pay much more than the copay. The other 5% of the time, we're very competitive with Mark Cuban. So it's great what he's doing. He's got a cost plus model for some generic medications that are low enough cost, they can be purchased without using insurance, right? There's no reliance on insurance there. Now, 5% of the market is not much, but in the pharmacy industry, when you've got $500 billion annually, 5% of that industry is still $25 billion. That's still a great business, great for Mark Cuban. I can do everything he can do, plus 95% of the other industry. I'll be much cheaper than him, and I can match him on almost all the cash prices. And he can't do anything I do on the insurance side, not one thing. So you just got to think about pharmacy and understand it's quite a bit different than most other consumer products. And I think what he's doing great. Mark Cuban's got a great company. It's good for patients. It's good for the industry. Love the transparency, but it's not a competitor than NowRx at all. Okay. Question number 6. Traditional pharmacists are a pretty important piece in the patient experience in terms of spotting potential med errors, educating on side effects, and informing patients of alternative medications. How does NowRx address this? And how do you offer similar value when a full-time pharmacist is not involved? Okay, got to correct the record here. Whoever asked this question, you do not understand the NowRx model. And the NowRx model is we have created micro-fulfillment centers where we house our own pharmaceutical inventory. We employ our own pharmacists. They work on site. We have 8 micro-fulfillment locations throughout California and Arizona, with 5 more coming online shortly in Denver, Colorado, Bellevue, Washington, Las Vegas, Nevada, and Houston, Texas. At each of these locations, there is a pharmacist employed by NowRx in that micro-fulfillment center doing everything you just said. So when a medication gets sent to NowRx from a doctor, and we're connected into all doctors' EMR systems, there's no change in workflow for a doctor. All the patient has to say is, please send it to NowRx. And in most cases, the doctor suggests it to the patient because it's better for the doctor also. It's not just better for the patient. Every time a patient has a bad experience at the pharmacy, they end up calling the doctor, and doctors don't like a lot of phone calls from patients, let me tell you. So no different workflow for the doctor. The prescription comes to a NowRx micro-fulfillment center. All they have to do is type in NowRx in their physician EMR system, hit send, electronic prescription comes to us, just like they would send it to CVS or Walgreens or any other pharmacy. It's exactly the same. When that prescription is received by a NowRx micro-fulfillment center, it's what? Verified by a pharmacist to do drug interaction checks, to do drug-on-drug interactions, drug allergies, to verify the prescription is accurate from the doctor. We then fulfill it, send it through insurance, get that process, coordinate with the insurance. Any additional information, we coordinate with the physician, all under the overview of a pharmacist. And then before the medication leaves the location, the pharmacist will offer to consult with the patient. We do pharmacist consultations all the time. Any new medication from a patient at NowRx gets offered a consultation from the pharmacist. Now, we're not next to the patient, so we do it via telephone, via text chat, private chat, or even video chat, right? So with NowRx model, we don't have angry customers in our stores because everything is delivery. So our pharmacists are freed up to do consultations without worrying about people standing in line yelling at them. So it's actually there's more access to licensed pharmacists to interact with patients and do one-on-one management and to interact with physicians than any other pharmacy in the country. So it's just a better model of pharmacy, guys. You just don't need the retail space, but we do everything a pharmacy does plus more. And we have a much better experience because fewer service failures due to insurance coverage issues, physician issues with the prescription itself, fewer inventory issues. We have one of the lowest out of stock statistics in the industry because of our machine learning algorithms on inventory. We have a fantastic logistics platform so we can coordinate with the patient better. It's just a better customer experience along with free same-day delivery. And you get everything you can get from a CVS and Walgreens. And we even offer over-the-counter medications. This question sometimes comes up in these calls. Yes, we offer aspirin, Tylenol, cough syrups, cough remedies, probiotics, vitamins. All of that is offered. It's easy for us to warehouse in our micro fulfillment center. So you literally get all of the same services you get from CVS, but you never have to wait in line again. You can go to your doctor, you can leave your doctor's office, go home, go to your office. That medication shows up in 2 to 3 hours, or even 1 hour if you need an expedited delivery. That is a new model for pharmacy, people. You need micro fulfillment. You need your own modern pharmacy management software. We've built all of that over the last 5 years. You cannot fix pharmacy by just adding delivery. You have to change the model and you have to fix the systems that are inside the pharmacy. And we are 5 years, if not 6 years ahead of the competition. So that's how NowRx works. Again, I'll just mention again, if you joined late, please go to our YouTube channel. If you have any of these questions about how NowRx works, I've done hours and hours of webinars. They're free to look at on our YouTube channel. Go up YouTube NowRx. Bunch of good webinars about our technology, about competitive landscape, about how to make money and how this investment even works at exit and all of that. It's all been recorded in webinars. And we're going to do office hours every day this week, same time, same place. So I'll stay a few more minutes here. I know we're coming up against the half hour. I'll try to get some more questions, and the ones we don't get to, I'll post out to the forum at seedinvest.com. Look at the NowRx profile page and go down to the comment section. I'll get those posted today. Question number 7. What's the progress on specialty pharmacy certification? How are you planning to roll this out over other fulfillment centers, existing and new? The specialty certification is in motion. We did one more round with the approval board at URAC. And the first review was about 200 items we had to fix. We submitted it. Second review was about 75 items. We're expecting to get approved any day now, and we'll certainly let everybody know about that. We're going to launch that out of one location initially and expand as we go, but one location should be sufficient in the Bay Area to handle most of the volume on the specialty side initially, but we'll see. That can be ramped up as needed. You can do multiple locations simultaneously. Once we know how to get through the URAC process and we have the policies and procedures that are approved, it's pretty straightforward to replicate that now across multiple locations. Again, we systemize everything, right? We're a tech company, so all the procedures and processes that are necessary to move us into the specialty field are now part of our software systems. That's one of the benefits you get by managing everything in the pharmacy under one software package that you control with no dependencies on third-party software people like my competitors have. All right, one last question and then we'll wrap it. Pharmacy valuations are typically less than 1x sales. I understand NowRx has great growth rate and lighter weight operating model, but it is still a relatively low gross margin business, as one would expect a pharmacy to be. How does Seed Invest justify the 200 million valuation at this stage? Well, exactly what you hit on it. Fantastic growth rate. You're not seeing the kind of growth rate in CVS or Walgreens or even independent pharmacies that you see at NowRx. Part of this is also because this is a truly disruptive opportunity, right? We have created a model that the big chains just simply can't compete with while they're focused on bringing customers inside a store. So there's a massive turnover and transformation of a $500 billion industry. We haven't seen an industry that large get disrupted anytime in recent memory. You could argue maybe Uber disrupted transportation to a similar degree, but this is definitely a very rare opportunity. We're seeing the growth. We built the software to maintain our differentiation and have a defensible advantage. So there's a lot of reasons. Our operating margin isn't just a little better, it's vastly better because of our efficiencies inside the pharmacy. This is going to be, our quick fill system is going to transform the industry both at NowRx and probably ultimately will become just the standard across the entire industry, either under a white label or it'll just be adopted after someone acquires us. This is truly transformational, and I think the valuation, if you look at other disruptive, transformational healthcare technologies, that is what Seed Invest looked at to set this valuation. To answer your question, we presented comparables. They did their own analysis at Seed Invest's investment committee. We were in middle of the pack, 10x revenue. We're not profitable yet, so we used a revenue multiple, and I think it's was a very fair valuation at the time. We've now grown 50% more than that, than where we were at the time that valuation was set. And so I think, if anything, it's a screaming good deal right now for investors. We are going to raise more money in the future and expect that the valuation will continue to ramp up substantially, given the way our growth pattern has been and given the new territories that we're heading into. We've identified 50 new territories across the United States. The money that we're raising in this crowdfunding round is going to fund that growth, and we will likely raise money again to continue that growth to 50, even 100 locations throughout the US, multi-billions in revenue potential. And so I think that valuation is quite fair, but everyone's got to make their own investment decision. Hey, thanks everyone for coming in today. It looks like we had great participation. The questions we didn't get to, we'll post out on seedinvest.com. Go to the comments section under the NowRx page. So it's seedinvest.com /NowRx Series C, and go to the comment section. Also, please do go to our YouTube channel. Look at NowRx YouTube. We've done hours and hours of webinars on all parts of the business. We also have public filings with the SEC. You can go to sec.gov, do a company search, look at NowRx. You'll see our audited financials for the last 5 years, and detailed write-ups from management about the business and the risks and everything. I don't think you can find a more transparent early stage company than NowRx, and so that should make you feel good as an investor. Thanks, everyone. We'll do this again tomorrow at 11. Take care. Thanks for joining.